How often do we contemplate the ripple effect of taking our medications as prescribed, particularly for our older adults? Today, we're peeling back the layers of medication adherence and how it is a cornerstone of effective health care, especially for our older adult population. I'm so happy to have with me today Dr. Sarah Almilli with us, the founder of ELAK Health. Dr. Sarah's journey from her personal story to her pivotal role in healthcare showcases her dedication to enhancing patient care. Her accolades, including the esteemed 2024 40 Under 40 Leadership Award, also speaks volume to this commitment and impact. In our conversation, we talk about the various facets of medication adherence, from the common challenges faced by older adults to how caregivers can better support their loved ones and the importance of discerning credible information. Dr. Sarah shares with us her valuable insights and practical tips as we explore how to navigate the complexities of medication and healthcare with Dr. Sarah. This is my interview with Dr. Sarah Almilli. Hi, Dr. Sarah. I'm really happy that you're able to join me. We're able to talk about some important things today. How are you? Thank you for being here.
Yeah, no, thank you so much for having me. Excited to be here.
Looking forward to this. So, share with us how you got started in this space, a little bit more about your story and what you're up to.
Absolutely happy to. I am an advanced clinical pharmacist, hence the Dr. Sarah, and I am in a profession and a current tier of the profession where we are kind of like physician assistants, if you will, or extension of the physicians. We do everything a physician can do, but we don't diagnose. So I have been fascinated that this is even a thing or a profession since long ago. I studied, I got my bachelor's, then my grad school, and then residencies, and then extra licensing, all to eventually be the advanced clinical pharmacist I am today. And I started in this endeavor, especially with ELAK Health, as a way to really help people understand the connection, if you will, between medications, diseases, health, what's feasible, what's not feasible, what works, what doesn't work, and really bridge the gap between the patient and the healthcare system. So this is why I started. That's my main mission and goal.
Yeah, I'm so glad you did. There are so many questions that we have around that. And I think we're really seeing the interplay and how connected it all is and finding support with our pharmacist, right? Just how important that dynamic is. Yeah.
Yes, absolutely. Yeah, and when people think pharmacist, most of the time people are thinking, the pharmacist behind the counter at the drugstore or the retail chains. And these are amazing pharmacists. Like, I give them a lot of credit for what they do. We cannot live without them either. And I'm hoping today and every day I speak is a bit of an educational component on there are so many different kinds of pharmacists out there. My kind of pharmacist, my profession does not overlap with outpatient. We complete each other in like the pharmacist from the drugstore and what we do, but we're not one, and we are all here to help though. We're all on the same mission. So just a clarifying piece because as we say pharmacist, people will always wonder like which pharmacist we're talking about.
Right. Oh, that's so true. I'm so happy that you spoke to that. And today, really, our lens is on the medication adherence, right? And so that is what we're going to be talking about. And I know some other things will come up as a result, as a result of that conversation. But first, like what does that mean? Can you explain to us what does medication adherence mean? Why is it so crucial for us to understand that? And specifically older adults as we're sharing about that today.
Yeah, so let's dissect that question. First, let's understand what it means. So, medication adherence, by the World Health Organization definition, to be exact, means it's the behaviors the human being practices in order to follow the medication directions, the lifestyle in terms of diet, in terms of exercise, and any other directions, if you will, that a healthcare provider gives them. So there is a direction and then there is a behavior, and adherence means how do you adjust the behavior to the directions given by a healthcare provider. And if you can get those to meet, then that achieves medication adherence.
Right. Ah. Such a good point. Such a good point. And so, how do we have this conversation? Like, why is it so crucial for us to follow that or have an awareness of that?
Yeah. So it's important to follow that because these medications are usually given with certain directions for a reason. And the reason is to treat the condition, whether it's a chronic condition and therefore they're chronic medications, or if it's an acute condition, like, you're leaving the hospital or you have a cold or you have the flu or sickness that it has like, it's starting and then ending. All these medications are given with certain directions to treat that condition. And that's why it's so important to be adherent and compliant to those directions.
Right. It really is. Hey there, I shared how Magic Mind helps me start my day with focus and clarity, and today I want to talk about something every caregiver understands all too well: stress. Caregiving can be incredibly rewarding, but it also comes with a heavy dose of stress. We're often running from one task to the next, worrying about how to be there for everyone. Magic Mind has helped me find balance I didn't know was possible. It's like a calming companion that helps me navigate the chaos of life and caregiving. With Magic Mind, I feel more grounded, less anxious, and better able to handle whatever comes my way. It's a unique blend of neurotropics and adaptogens, which not only boost my focus but helps keep stress in check, allowing me to fully show up for my loved ones without feeling drained. If you're looking for a way to bring more calm and less stress into your caregiving routine, I invite you to give Magic Mind a try. Head to magicmind.com and use the code Navigating the World 20 at checkout for a 48% off your first subscription or 20% off one-time purchase with code. So let's take care of ourselves so we can give our best to care for others. And in our world of looking at caregivers, right, a lot of times we are responsible for whether it's administering or overseeing that or participating or oversight. And so, how do we set people up for success? I think that's our main goal, right? And so, how do we overcome some of those common barriers for
Yeah.
for that?
Yeah, that's okay. So that's a loaded question. So let's dissect that. So, in order for us to understand or to even fix the barriers, or like how do you overcome the barriers, we first need to identify what the barriers are, and then even before then why they exist, right? So first, let's probably hit it from the core. What is the problem? Why are there barriers? And then we'll figure out what the barriers are.
Love
So
that.
why are there barriers? There are barriers, if I were to sum them up, I would probably put them in threefold or three buckets. There is access, right? That causes a barrier, access to healthcare providers, whether it's your pharmacist or your clinician or your physician or your specialist or whatever it is, but it's access to that. And access consists of like the length of appointment, when you get your appointment, how far your appointment is out, like who are you getting your appointment with, and what are you talking about, and all these things that all goes under access. Then we can talk about, or like the second reason for barriers is education. What is it that you're taking this medication for?
Mhm.
What are you treating? How does it work? What is happening when I take it? What happens when I stop it? What happens if I don't take it correctly? What happens if I don't refill it or like continue it? So there's a lot of education and components in order that create barriers. And then last, which is always the elephant in every room, the cost, right? The cost barriers. Do I need this $2,000 medication, or is there an alternative for $80, right?
Mhm.
And what is my insurance saying versus what's my doctor saying? And why is my insurance saying this versus my doctor saying this? And how can we get them both on the same like page, right? So these are the reasons, if you were to ask me, in my opinion, why we even have barriers. Then, if these are not perfect, which unfortunately currently we don't have the perfect world, so we have these reasons for barriers, then they create the barriers. So let's talk about what the barriers are. The barriers are now we have lack of education. So therefore, we don't know why we're taking the thing that we're told to take.
Mhm.
And therefore, if I feel fine, I'm not going to take it because I'm fine, right? Why would
Mhm.
I take it? So then we start doing self-adjustments, and or we start saying like, oh, this is too expensive. I cannot for this medication. And this happens a lot more times than not. And it has nothing to do with, rich or poor or whatnot. We're in inflation era, right? Every dollar is competing for whatever else. If we say no to something, we're saying yes to something else, and the opposite is true. So then cost becomes a barrier. Then now we have the barrier of, like, who do we ask? Like if I have a question, now don't have the education, I don't have the money, then who am I asking for all of this? And that all becomes almost like a recipe for now we have all these barriers, and that goes back to your question. Well, how do you overcome the barriers?
So
Right?
true. Yes, thank
Sorry,
you.
I took you on a loop there. Tell me if I need to re-summarize before I answer your question.
I love that. I love how you simplified that because when we can picture what that is first, then we know how to address it. So perfect. Yes.
Yeah. So then now we've identified why the barriers exist, what the barriers are, and now let's talk about how do you overcome the barriers. So if we can go back to, instead of focusing on what the barriers are, I have a philosophy of always trying to hit things from the core. Let's hit the core issue, and then hopefully everything will fix itself. So if we can hit the core, which is the why, education, access, cost, then hopefully we'll overcome the barriers naturally, which is the self-adjustment, poor knowledge, right? Like all that.
Mhm.
So how do you overcome? Every person everywhere in this country is different. So I can't have a general statement, but I will give you some perhaps more general guidelines. The first one is access. Go to your appointment with questions prepared, right? Or if you are surprised with some news, whether it's a diagnosis or a new medication that's given on the appointment, before you leave that appointment, set up another appointment to ask questions. Now, I understand that access is a barrier on its own, but that is better to have something to fall back on before you even leave that appointment, because questions don't arise to all human beings on the spot. We all take time to process.
So true.
So yeah, while you're in like the appointment, right, and like your doctor's saying things, and then now you're picking up your medications and you think you know it all, then you go and you try to take your medication and you're like, wait a second, wait, I have all these questions and now I don't, and I have nowhere to ask. So always ask questions or prepare for an appointment to ask questions. Number two, find, if possible, a way to reach out to your physician. Is there a secure message? Is there a text message? Whatever it is that is needed to have a fast answer. Now, fast is subjective, but fast answer that you don't fall behind really quick. And that could be your pharmacist, right? It could be your pharmacist in the outpatient setting. Now, granted, they don't know all your health conditions and your history, but they are more than capable of answering questions regarding medications if that's the question.
Mhm.
So that's one way to overcome that barrier. Education. Education is a huge one. I see this more times than not where people refer to like internet resources and they just, right,
Right.
search, give me the side effects about medication X. And
So
then bam, you're like seeing all the things that tell you like either you're gonna face every side effect under the sun or like, oh my gosh, you're gonna die. Like,
I
and
know.
that leads to a lot of confusion. I think I'm like super passionate about this topic because I wish I can stop everyone from searching the internet about things
I know.
regarding health. But if you have to, I understand. If you've exhausted your physician resources, your pharmacist resources, you have no one around you, then at least know how to find the right information with some disclosures in the background. Some disclosures are everybody's different.
Mhm.
And that I literally mean that every human body is different. Nicole, what you experience will be very different from what I experience, even though we may be the same age, same everything else, but it's a human body and just the nature of things. So some tips there are um, lean on guidelines. This country has a lot of guidelines, and we're very blessed to have those. So if you're gonna look up is metformin good for my diabetes? Let's just pretend, okay, I'm making this up. Then perhaps go to the American Diabetes Association and see what they say about that versus like metformin, ask about metformin.com, right? I probably this website doesn't exist, but I'm
Right.
making it up.
Mhm.
But it's better to go to a credible resource. Um, Also still know that everyone is different. So that's we targeted the access, we targeted the education, and now the cost. If you ever have any questions, I think that's where your pharmacist will truly, truly come into play. I think we're the experts in all things insurance, especially the outpatient setting. Otherwise, you can always lean on your like insurance brokers or insurance like call your insurance company and ask what is happening and why you cannot get this medication. And if there are alternatives, usually they tell you because you didn't try X, Y, and Z before you got on this X, Y, and Z. Then you can go back to your physician, close the loop, and ask the questions.
Yeah.
I talked a lot. I'm sorry. Ask me more
Oh,
questions or
okay.
like let me
No.
clarify whatever is needed.
I love it. And you had a couple of questions that I thought through as you were sharing. So thank you for that. There's so much information out there. And you had talked about, how do we interact with our provider, right? If we're going to go to our provider and ask some questions, what do you suggest? Like, what are really good questions we can ask to better understand and manage medications? Is there any, best questions or things that we can think through as we're doing that?
Absolutely. So, if you're getting diagnosed or if you have a chronic condition, for example, ask how does this disease, work? How does it impact my health? What is happening truly in my body? I'll pick on diabetes because it's one of the most relevant diseases, that we have.
Mhm.
Diabetes, most people think, oh, if I stop eating candy, life will be great, right?
Mm,
But what is the nature of the disease? Like, why do you get prescribed, for example, a statin as an anti-inflammatory for diabetes? Ask how diabetes work. Diabetes is a cardiovascular disease. It's a disease that affects your heart. It may put you at risk of stroke. It causes inflammation in your vessels. So if you don't know this, you will have a hard time understanding why you're on an anti-inflammatory medication, for example, like a statin.
yeah.
So that's my number one question that I recommend. If it's about a medication that you're being prescribed on the spot, the same question applies because I think the why is the most important question behind whatever is happening. Why am I taking this medication? And then the how. How is it helping me? So if you lean on those, I feel like, or not, I feel I have it's been proven that if you just ask these two questions, your adherence chances actually increase. You're more likely to adhere to your medications because now you understand the why and the how. Then
Mhm.
the what and the when is on you.
Right.
You get to decide that with your own behavior and lifestyle.
Right, right. Yes. And you brought up such a good point. I mean, how many of us go on the internet and search for whether it's the medication or side effects or things like that? And it pulls up so many things. Like, how do we know what's reputable? How can we support older adults and caregivers if they are needing to use the internet? Is there some tips? You brought up a good point, but any more thoughts on that?
Yeah. Some tips are some how do you call those like that .gov or .edu.
Yeah.
Usually they're more credible in general. I am not discrediting the .coms, but usually these are very good first line resources, if you will,
Mhm.
because they're government based or they're education based, coming from universities, coming from research, coming from government entities. So there's a lot of liability on these resources to maintain their credibility because
Right,
they are meant to be educational for the public.
right,
If all fails, then even if you go to a .com resource, that's okay. But know who is writing that blog that you're reading. Is it like I have had patients that would say, like, I read this on Reddit. Well, who's writing it? Well, the person who's taken it. Okay, well, they've experienced side effects that will not apply to you. So now you've scared yourself off from taking something that's so helpful to you because someone else had a challenge.
right.
Is this really where you want to draw like the line, right?
Mhm.
So understand the author behind what you're reading. Know the author.
And it's such a good point to understand the credible healthcare resources versus a Reddit where we've got just everyone has an opinion about something these days, I found. So when we're searching for medication information online, a lot of times we see data, statistics, percentages. How do we interpret those figures to make informed decisions about our health?
Yeah, that's a great question. So a couple of things happen. Usually there are no statistics sometimes, and it gives a list of side effects. Like if you take this medication, you're going to have, it's literally like 15 different things, right?
Right. Yeah.
And you're just going to experience all of these, just like TV commercials. Watch out for little, 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 like, and it goes real, real fast. And you're like, oh my gosh, I'm supposed to take an antidepressant because it's supposed to help with my mood. Yet there is like a warning on my bottle that I may be suicidal. Like, how does this work?
Right, right.
Right? So again, it goes back to the credibility to now the statistics, which is what you bring up. The statistics are, and this is something even we practice for the most part, what is the percentage? If it's 1% in the population that will experience a mood swing because of a side effect of a medication, the chances are this is not necessarily going to be high and that you don't need to worry about that because it's 1% of the population. So you do the math on that.
Mhm.
And there are risk factors to these elements and side effects. Um, I'll give you another example. Sometimes there will be a side effect that's like 5% of the population will experience this. If they have bad renal function, i.e., like bad kidney function, and they are also taking this medication, and this is also going on, then of course, yes, you will experience these things if you have these risk factors. But will you experience it? Will you experience them if you don't? Ability or not really.
Right.
So I usually try to look at percentages where I practice. I try to look at 10% or more.
Mm,
10% of the population or more are going to experience something, then yeah, I should warn my patient, hey, you may have some nausea. It's not for sure, but if you have it, do X, Y, and Z to conquer that. And usually there are ways to conquer if it even happens. Which goes back to the education, ask your pharmacist.
right, right. Yeah, seek out that education. Are there any red flags that we might notice when we are looking at information that's not credible? What do you find in that space?
I'm almost certain red flags may not be apparent to someone who doesn't have the knowledge and the experience in the field.
Mm,
This is like me reading, say, what am I very bad at? I don't do anything engineering, for
right.
example, right? I'm not
I
good
don't
at this.
either.
Yeah. So if I read something regarding engineering online, I will have no idea whether that's a red flag or a common thing. I will just believe whatever it is I'm reading. Versus an engineer reading something, they're going to be like, "Oh, this makes no sense. That actually, oh, that's a bad website. Don't
Right,
go there."
right.
I am having a hard time identifying what a red flag would be for someone who is not necessarily embedded in the healthcare field.
Mm,
I guess the only thing I can think of right now is if it says like, do not take this medication, right?
mm.
Unless you talk to your doctor. And if you just talk to your doctor, then it's okay at this point, because yeah, now your doctor must have fact checked all these things.
Yeah. Yeah. Yes, yes, so true. So another conversation as we're visiting, you and I in our conversation previously had talked about immigrant empowerment, specifically for women, but I also think that it bears the conversation around healthcare. So what do you find and how are you hopeful? Is there more access to healthcare with the immigrant population, but also specifically having knowledgeable people that we can go to and also make sure that the equity is there.
Yeah. So let me preface by saying I'm an immigrant myself. I come from an immigrant family. Um, and I came here when I was 17, so technically half my life.
Mhm.
And my parents came here as they were older in the 40s and 50s, my whole family. And I see this a lot. I see it with a lot of my patients as well. Unfortunately, the access and the education and the cost almost amplify to a double, if not more, with the immigrant population,
Mm,
right? So ways to conquer that is, and I've had this with some of my patients, if you're looking, for example, for a physician to follow up with, I had patients very adamant that they want a physician that shares their culture competency. Now, it
Mhm.
may not be the language, right? But at least it could be the culture. Um, can, is there a Hispanic physician for the Latino patients? Even if the patient does not, even if the physician doesn't speak Spanish, they understand, let's say, the way they eat, how they sleep, how they work really hard, their working hours, whatever it is that they are going through culturally.
Right.
um, Other Middle Easterns, for example, I come from a Middle Eastern background, so we may not have the language, right? It's not the most predominant language here in the US, but could we at least have a physician that comes from a similar background or a close enough background to understand like what Middle Easterns are going through? Maybe, you have the Christians and you have Muslims, for example, religious people. Ramadan is happening right now, right?
Yeah.
Most Muslims are fasting all day long. Is there a physician that can understand what that means and how the day is flipped, and understand that cultural barrier or cultural element to conquer for their medications and disease states? So
Mhm.
I think what I'm really saying is a long-winded answer to say, as weird as this sounds, it may be better to surround yourself with someone who's culturally competent or culturally close to your culture, regardless of language, to be able to have the relevant education and access that you need and deserve.
When you were talking about, right, the fasting right now, some medications you need to take with food. So just understanding those different dynamics at play. Yeah.
Absolutely, absolutely. Some of our patients right now, right? Like, I can't tell them to take their medication in the morning. I need to be realistic. It's everything is flipped. So the morning becomes night and the night becomes morning, and we have to do this for a month. And how do you transition back before,
Mhm.
after Ramadan? And how do you transition into Ramadan? And you have to titrate slowly because your body doesn't just realize it's about to fast tomorrow. It's a transition that you have to take your body through probably a week before and then for a week after. It's a lot of navigating just for like a certain like couple of medications even, but they're so crucial to your health and how your body reacts.
It is. Thank you for sharing about that. Um, okay, the next question I'm going to ask if you have any thoughts, but we can skip it too. But are there any tools or apps or websites that you recommend for people that are managing medications? Do you have any insights on that? Okay. Okay. Um, what do you recommend for any tools, apps, websites for people that are wanting to manage their medications and find that reliable information?
Yeah. So this is a great question. Reminders are important, medication. So after you know why you're taking the medication and how you should be taking your medication, now it's time to adjust the behavioral piece, right?
Mm,
To put it into your lifestyle. So I've come to realize that, not to stereotype anything, but some patients are very paper driven. And they like all things on paper, logs and medication reminders, everything. So for this patient population, if you prefer paper, then have a medication log or sheet for yourself and perhaps put that on the fridge.
mhm.
And make sure that you're updating as things change all the time. But like, it's so important to have that visibility because your eyes and your brain work together to then understand that, hey, I need to take this medication or I'm on these meds. Did I take it today? And I would couple that with as simple as a pill box. Sometimes we forget that those exist.
So
But
true.
like, plan out your day, plan out your week. Maybe take 5 minutes every Sunday to plan out your pill box for the week. And it will be so helpful if you do that because you don't have to open all these bottles every single day and different times of the day. Um, I would couple that with, now for everyone, obviously, how do you integrate these practices into your day? So, medication to be taking, fasting every morning before food or coffee, then perhaps that bottle needs to be on your nightstand with with a cup of water before you go to sleep
Yeah.
because you're going to wake up in the morning and take that medication, right? That's not in your pill box kind of medication versus medications to be taken every morning, just every morning. Perhaps these medications can be taken in association with something that you do routinely every morning. Do you go and you go to the stove or the kettle and make your coffee and it's time to make three medications? Or is it brushing your teeth and getting out of the house? Then maybe they need to sit there, not in the bathroom, but at least sit close enough to brushing your teeth area.
Mhm.
Um, so that's for in terms of reminders and lifestyles. Going back to paper, if the patient is more of a technology based, like they'd rather do apps,
Mhm.
then there are oh my gosh, I was just looking with a patient the other day. There's so many different apps and reminders on adding your medications and having it like remind you it's time to take your meds, and programming that. It still takes, updating all the time because things change, but they exist and there's free ones out there. So I don't want to mention any apps names because I don't want it to be like that I'm associated with any of the apps, but they exist and they're free. So utilize those to your convenience and to your benefit. And then last but not least, there's a lot of healthcare technology that's emerging in this day and age. So there are now iPads that are just meant for like caregiver and care companionship. There's now devices that are being put in homes and they actually have the medications inside and they would remind you to take the medication and even like beep if you don't take it and record that you've taken it. So there's a lot. I think it depends on education, access, and cost again, and what works best for you.
Right, right. Yes. And with cost, how do we access those programs that maybe could help us? Do you have a place where you like to direct people to look at when we can get support in some of those costs, or is that an option?
Yeah, yes. So it's so subjective. I try to have that very individualized conversation with every person separately, but for the sake of this, conversation, there's a whole spectrum. There are free apps, there's papers, there's then the like medication reminders on your phone, like a simple, like if Android or Apple, it doesn't even matter. There's like literally just reminders, remind me to take this at this time. And then there's like machines and iPads that you can purchase and you have access to, your family members have access to, and they could vary from like a couple $100 to subscription monthly to a couple $1,000 and then monthly subscription. It's the spectrum is very big in this arena.
It is, yes. And for people that are like, what if I need help with pain for medications in general, not necessarily only the reminder side, but is there that option as well?
Yes, thank you for actually reminding me to talk about this. Yes, don't give up to the whatever $100 copay or a couple $100 copay. There are options. I had a patient, I will give you an example and I give you the answer through the example. So I had a patient a couple weeks ago that was given a prescription because she had an infection and the infection was an abscess and they needed to clear it to do surgery. So it's important, right? However, the antibiotic was quoted at $400. So what did she do? She decided not to pick it up because she was like, I'm not in pain. It's okay. It will heal itself.
Mhm.
And when I had my appointment with her, and it was like, wait, what do you mean? No, it's an infection. We can't just leave infections.
Right.
So some things to do is she asked the pharmacist, right? So in this case, the patient was with ELAK Health, so we meet every so often. And she asked the pharmacist, who then figured out the importance of taking the medication and then now the resources. So we did two things. Number one, we contacted the social worker that would be in the hospital system that she is a part of. And then number two, we looked at drug or medication coupons. And I actually found one immediately and and then I called a couple of pharmacies that I am networked with ELAK Health. And then through all of these steps, we actually got the medication copay to be $56 from $400. So we were
Amazing.
able to get her the medication, clear the infection. And if you have that access and education, and in this case, the patient was, because again, she was part of ELAK Health, so we meet every other week, like on the dot, then I was able to catch that in time and order the medication for her and then clear her infection for her surgery to go through.
It's so nice. I'm so glad you could do that. For people that have medications and they're like, I'm not using them anymore, I don't want these in my home, how do we safely dispose of those unused expired meds?
long ago, my parents, I found out that they flushed the medications down the toilet. My own parents, okay? They have a doctor daughter. So please do not flush anything down the toilet. I will say that as the beginning statement. This is not good for you or for anyone's health. The best ways to dispose of your medications are only two options, honestly. You either go to a pharmacy next door that has the medication disposable bins, and they usually advertise you can dispose of your medications here, or you can go ask them and they will tell you if they have it or not. The other option that's feasible to most patients is your closest police station or fire department. They will dispose of the medications for you. So just take your whole bucket of meds, drop it off there. They will happily take it from you. So pharmacy or police fire. That's
Okay.
it. No toilet.
Ah, good to know. So good to know. I don't know if we really know that firsthand unless we have to go through it. So it's so helpful to have those tips. Yeah.
Yeah,
Okay.
no toilet, no trash can either.
Right.
Sorry, I forgot. No trash can, because the trash can ends up also in the same places. It's
It
all
does.
fill.
This has been so important information to hear. I also think it's important to talk about what happens if we are not adherent to our medications. What can you share about that?
Yeah, I'm so glad you asked. There's a lot of information and research and statistics regarding this. So I'll give you big examples and smaller examples. Cardiovascular diseases, that's your heart attacks, your strokes, your diabetes. 60% of this patient population are non-adherent to medications.
Mm,
60%,
wow.
which leads to 10% of the reasons why they end up at the hospital. And I'm
Mm,
only talking about this disease state umbrella. 34% of the patients that leave a hospital for any disease state, 34% of all Americans that leave the hospital do not pick up their medications at all from
that's
discharge.
surprising.
These numbers are real. And then from there, if they pick up their medications, you have 24% of all Americans not using their medications two or more after discharge, and then 12% stop all things a
Mm,
month after they leave the hospital. Whether they think they're fine, or is it the cost, or is it the education? They don't know what the medications do. I don't know what the barriers are. There's obviously plenty, but these are some major, major risks and why people end up in hospitals and our emergency rooms. It crowds our spaces. Then we enter a vicious cycle. You enter the ER for reasons that were prevented. And then in the ER, you're complaining about the wait time. And then after the wait time, they say, go see your doctor. And then it's like a vicious cycle over and over and over. And then that lack of education, if you enter a hospital because of lack of adherence, because you didn't know what the medication does. Then you end up in a hospital again. Then that piece increases by 2 days on average for all Americans if they don't know what the disease state entails and what the medication was used for. So I'm trying to paint a picture that adherence seems like, oh, an everyday behavior, like some people take it lightly,
mm,
but it's huge. 10 to 30% of people end up in a hospital just because they don't have the medication adherence they should have. So again, I can't stress the importance of this enough. Address the barriers, have a pharmacist or a physician, have someone that doctor at your fingertips, like I would advertise for ELAK,
mhm.
and know that the risks are high.
They are. When you say those numbers, it's like, whoa. That is so high. So you talk about ELAC, which I can't wait for you to tell us a little bit more. How are you supporting others and where can we learn more? Share with us how you are educating and all that you're providing us.
Yeah, so thank you. I'll briefly just give you the highlights of ELAK. So ELAK shares my mission, which is bridging the gap between the patient and the healthcare system. Really, that's the only mission that we have. And it targets the three factors I talk about. It targets the access, the education, and the cost. So from an access standpoint, ELAK is the entity or the providers that will be with you once a month routinely, or once a week, or once every week. It's based on what you need. We'll be there every single time. It's an hour conversation, not the 15-minute conversation. It's that we go with the patient to their doctor. So then we bridge even more and closer. So that's from an access standpoint. From an education standpoint, obviously you have access to the biggest resource, right? Which is the pharmacist like army that we have, like, or the pharmacist army we're trying to have every patient have. If you have that pharmacist, especially in like those clinical pharmacists at your fingertips, like that doctor at your fingertips that you can like text at 7, I have nausea, I don't know what to do. Is this because of my metformin? My blood sugar is high. What do I do? My blood pressure is low. How can I do this? That unlimited text messages within ELAK Health to straight to your provider. I can't tell you how many ER visits we've saved since we've started because of this alone. And then the cost, as you've seen me or heard me mention in my example, right? Like you get faced with like hundreds of dollars. They're like, oh, no, 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 it's okay. There's ways to do that. Let me help you out and make some calls and like have pharmacies and get coupons and talk to the insurance and figure this all out to go from the $400 to the $56. Now you're healed of your infection. So that's practically ELAK from a very high level, is that doctor at your fingertip to remove the barriers that would have caused the lack of adherence.
It's so helpful. We need that advocate on our side, right? To have effective healthcare and to be supported in that. So I'm so happy that you're able to bring your expertise to us and the field. And thank you for sharing all that you know with us today.
Yeah, absolutely. And to reach us, it's elakhealth.com or .org, right? Whichever one.
Mhm.
And then you will see, even if you Google like ELAK Health, we will come up. You'll see my face, you'll see our number and everything. I'm happy to talk to anyone.
That sounds great. And we'll include all of that in our episode notes so people can just click on the link, be directed to you, ask all their questions, get your valuable insights and practical tips on how we navigate it because it is complex. So we need that support for sure. Thank you.
Of course, thank you.
Are you looking for another encouraging podcast? Let me introduce you to my friend Elizabeth Miller, the host of the Happy Healthy Caregiver podcast. She visits with family caregivers and dives into their caregiving and self-care strategies. She also highlights that family caregivers are the experts in caregiving. Beyond the informative conversation, Elizabeth reveals the tried and true resources and practical self-care tips that empower caregivers to prioritize their health and happiness. You can find the Happy Healthy Caregiver podcast wherever you download your favorite podcast or go to her website, www.happyhealthycaregiver.com. Thank you for listening today. If you enjoyed our episode, please subscribe and give us 5 stars. In all honesty, we'd love to hear from you. Thank you so much for listening to our episode.